different nuance and tones, and so I'm learning these two instruments as well as the others I showed you. Okay, to put it this one back. So I'm going to bring all these instruments back home, so I will enjoy this one for the rest of my life. Okay, so now short, we have radiology. When I was in medical school, we call it X-ray department, because X-ray was the name by a physicist, German, Wilhelm Röntgen. So often we call it Röntgenology because his name is so famous. And he took the first picture of his wife with the rings. So that was his accomplishment. He has won the first Nobel Prize in physics in early 1900. And to honor his accomplishment, the chemist named elements 11th elements of your element, Röntgenium. So I learned. So seeing through the body for pathology, that's what you're doing it. We have mosquitoes here. So you need to know normal body anatomy and then learn pathology. But these changes, they will be compared, looked, used to make diagnosis for your patient. So it came as a radiology because using X-rays, and I used to go to the radiology department, wait until the film that get developed, and then I watched and we discussed with röntgenologist, X-ray man. So that's kind of fun and like detective works. However, it of course changed, added sonograms and CT scans and MRIs and PET. So that's all about imaging. So these days, when you go to hospital, they, of course, somewhere they have radiology department written on the label, but most of them says imaging, 영상 전문이에요. Okay? So they call it 영상학과, imaging department. So in the imaging, I hope that you get used to the pictures of X-rays of normal state, so that you can compare with a sick person. And it, of course, is a picture, so you how you look at it, angles and front and back and side. There's all the names of angles and views. And when you have too much exposure, what happens? The picture comes as a white, too light. And if you have then low exposure of the radiation, and you get too dark. So you have to have right exposure. That's the important part. A technician will give you a good picture. So after radiology, people try to inject that radio-opaque material to the blood vessel, and as that passed through, that radio-opaque material passed through the blood vessel, you take a picture. We call angiogram. Often angiogram is these days we do through the heart. So you pass the catheter and you hook into the coronary artery entrance, and then you inject dye, and that dye passes through the coronary artery, and then you take a picture. That's what we call coronary angiograms, coronary artery angiogram, or to be more exact, angiogram of coronary artery. And they take pictures like movie, so that cine angiogram of coronary artery. So that's what you're doing it. And fluoroscope, it's you look at it as things are moving. So fluoroscope is usually we use the term as you swallow the barium, and it swallow the radio-opaque material, pass through the your pharynx, esophagus, and the stomach, and you take a picture, fluoroscope. And then these days, radiologists do invasive radiology because they are guided by the fluoroscope and take a biopsy of breast and other parts of your body inside. And ultrasound using sonograph, it's a way of submarine, 잠수함, will see the things above the water and in front of them because they are blind in a sense, but they use sonogram like whale, like Korean, right? So ultrasound. And then these days, CT scan, we used to call EMI, but now they don't use any term called CT, computerized tomographic, CT scan. MRI, magnetic resonance imaging, MRI. PAD is positron emission PAD. And there are terms actually in page 593. So I hope that you will see that page and then learn. So let's say when I ask questions and write all you learn medical terminology in radiology, and you're gonna write those terms you memorize as many as you can in Korean and English. So 593, it says KO. So I hope that you have all book and already read about it. And it begins 결합형. 의학 용어 결합형 means the suffix and prefix 붙이는 결합형, bradycardia, brady, echo, intra, fluoro, radio, röntgenal, scintillo, sono, tomogram, graphy, opaque therapy. So kind of explains to you what that means. And so let me see, it has so many, I think it's about 100 terminologies in there. So you will get, those memorized, right? And you answer and you will get your credit. So so let's see, go on maybe few of them. In radio imaging, there are two kinds. It shows up as a white, means radio opaque, usually bones, radio opaque. And lung has air in it, so is a radiolucent, means black, because you are seeing negative film. So on page 596, there is normal chest x-ray. So when you look at the chest x-ray, there are so many anatomical names you see it. So you name it. Maybe you can name 50 of them, and there are so many. Radiolucent, radio-opaque. So let's say diaphragm, stomach gas, you have chamber of the heart, right border, left border, and there are bones, many kind of bones, you name it, vertebras and clavicles and costal ribs, and you see scapulas, and you can see the joint of the shoulders. So you can see so many shape of the aortic arch comes out, and there's a shadows coming down from trachea and bifurcation it shows, so that you will see so many. The more you see, and then you add pathology on top of it. And by reading this chest PA, chest PA means you have hugged the machine so that the light comes from your back, posterior, to the front, anterior. So we call it chest PA. Now AP means you lie down on the floor, you have X-ray beam comes upon your front, A, anterior, pass through the back. We call it an AP. So we usually get chest PA rather than AP unless the patient cannot stand up. So you will see usually chest PA, posterior anterior pictures. And just chest PA, but also you will be side view, lateral view. The lateral view is side, so that film is on your side. And then beam comes through from the other side. So when you have film on your right side, we call right lateral. When you have film on your left side and the beam comes from the other side, and then depending upon where the film is, you call it. So right lateral here, left lateral here, the film. So, and oblique means you take a picture, not the lateral and the ways, you take oblique, side view. Not the really, something in between the front and side. So 45 angles, different angles. So the oblique view is necessary to see different parts of your body. So you sort of have to know complete three-dimensional anatomy to be a good radiologist, because you have flat picture, but you have to imagine that you are seeing three-dimensional. So like you're seeing horse, but you're seeing the horse three-dimensional. So that's the kind of way of imagination a doctor has to do when you look at the film. Okay, so many, okay, here's my last advice. How to study medicine. Now, the attitude to study medicine means reading books and preparing your exam is the same thing. And studying and preparing for exam is so many things you have to do from now on. Until you finish your board exam, 전문의 exam. So I'm not really sure how many you have to go through, maybe 100. I never counted. So, so many exam you have to do, and that's the pain in the neck, so to speak, unnecessary or necessary evil, you call it, has to go through. So when you do that, and you have to prepare, and you listen to the lecture, read a textbook, and then memorize things important, and classify all those scientific findings, and you formulate and you get knowledge in your brain is a sort of structured, not mingled together. You need to kind of classify structured informations and wisdom in your memory box. But attitude is important. How you study, how you learn. And I emphasize sincerity and perseverance. And actually, you might call this one 정성. Put together all your effort. 정성을 들여서. And then you read, of course, along your textbook. The textbook gives you two things for you: principle and practice. So these are the combination. Having both. Why do I do practice medicine? Because I know the principle. Yeah, without knowing principles, you cannot do good practice. And if you know only practice, if you know only principle, maybe you can just teach basic science of medicines. But practice is very important, so you do need both. And with the principle and practice, and with the knowledge of you have learned sincerity and perseverance, and you take care of your patient. So that's the main goal of doing it. So how do we take care of the patient? You take care of your patient like you are your midwife. Sampa. I don't mean exactly sampa, but that's kind of work. What does she do? Sampa. So you take care of the baby coming out of the mother, same way. You take care of the baby as they grow up and become older and become aging. And then when you say bye-bye to a patient, when they live in this world, you also act as like midwife. Care, sincerity, your compassion, and your communications, and you are sort of part of him in a sense. When they die, you don't die, but you see their last breath. So by doing it, it's a very tiring, sometimes very stressful, you call it, or too much excited. So you need to calm down, you need to enjoy, make yourself better. So enjoy and, A-N-D, be well. Why? Because you're a very important person. Now, of course, I don't mean only doctors are only important, and not politicians, not soldiers, not taxi drivers. They are all important. But you, a physician, is very, very special. That's why I mean is important. Why? Because you will be the person know your patient's heart and your patient's soul. And you are the profession, you are the healer to stay with them until they die. We cannot go with them, heaven and hell, but that is the beyond our existential limitation. So that's what you're doing it. So what I did so far for you, with you, my friend here, we learned medical terminology, 첫 단추 잘 끼기. That means I invite you to the medicine, open the door, you will go through the learning with curiosity, with sincerity, with perseverance. You're going to learn that with the secrets of life, full of joy and full of So you're gonna learn that. So to learn that one, 첫 단추 means medical terminology. And then 둘째 단추, I would call it physiology, histology, anatomy. Yeah, those are kind of pharmacology and later pathology. Yeah, immunologies, infectious disease, and microbiology. That's the 둘째 단추, second button. Second button, yeah. And third button is, of course, clinical medicine. Pediatrics, internal medicine, surgeries, ENTs, dermatology, radiologies, all other psychiatrists, and that's a third 단추. And I don't know what the number 4 button is. Number 4 button will be probably your own specialties, depending upon your specialties. Surgeon, pediatrician, internal medicine, geriatrician, orthopedicians, gynecologists, obstetricians, you name it, all those. Plastic surgeons, and endocrine surgeons, vascular surgeons, cardiac, thoracic surgeons, and so many subspecialties you have. That is your maybe number the 4th buttons. So when you do that, and you will be a very, very knowledgeable person, full of wisdom, full of compassion, and you are capable to do things more than anyone in the world, any more than president. You don't have to have Nobel Prize to do that. You will be the person, do your best in your life to help many people out of miseries, out of pain, out of despair, out of their sufferings. So I depart here. My last note that when you do that, good job. And you did good job as a healer, as a physician. That was done very well by your good effort, by your good, sincere